Every second counts in emergency medical situations. Today in our McLaren Medical Minute, we learn how the triage process works when people go to the emergency room for help.
My name is Rudoni. I'm the medical director of the emergency department at McLaren Regional Medical Center, now called McLaren Flint. And if you were one of the 66,000 people that came to our emergency department last year for medical treatment, you're probably wondering what goes on in this area, which is the triage process. The word triage means to sort by severity of illness, and it's a word that was coined back in the wars many years ago when doctors on the field had to determine who was the sickest in order to be tended to first. Something very similar occurs when you come into the emergency department. If you come through the ambulatory entrance, which is where most people walk in, you will give some primary information to a triage nurse. The information that they will gather is how we do our triage process, which are vital signs, which include things such as blood pressure, heart rate, respiratory rate, and the level of oxygen in your blood. And the triage process is designed to figure out who are the sickest people that need to be tended to first. So, for example, you may come into the emergency department with a sprained ankle. You are deemed to have a medical problem, but not something that needs to go ahead of somebody else who may be coming into the emergency department and triage to a more acute or severe injury pattern, like if you were having chest pain or having a possible stroke. The nurses have specialized and extra training to determine who is sick, and they do a very good job of determining who needs to get back first. The triage process is the same in most every emergency department. It's a hardcore standard process that we use over and over again to try to ensure that the sickest people are cared for first and the least sick people can wait until those that are sicker are tended to.
For more information on the story, you can visit McLaren.org. You can find that link on our website, abc12.com.
Well, older patients